Do you get pain in the arch of your foot when you're walking? If you get pain in the arch of your foot when you're walking, it's very likely that you've either been diagnosed with plantar fasciitis or may have been reading on the internet and think you have plantar fasciitis. But there are many other things that can cause foot arch pain when you're walking, and getting hung up on the diagnosis of plantar fasciitis can actually stop you from getting better. Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain some of the various things that can cause foot arch pain, but even more importantly, how you can get over your foot arch pain so you can walk longer without pain and discomfort in your foot. So first of all, what causes foot arch pain? Well, there are several structures in the bottom of your foot, ranging from your foot bones in the deepest layer, then 4 different layers of muscles inside your foot, and in there are nerves and arteries and veins as well. So to think the only thing that can cause pain in the bottom of the foot is plantar fasciitis is an oversimplification. And furthermore, from clinical experience, it's rather rare that people have true plantar fasciitis. In fact, plantar fasciitis itself is rarely an itis, meaning it's not inflammatory. But the plantar fascia is the superficial covering right on the front of the foot. Beneath that, there are those 4 layers of deep muscles, and entwined in those layers is the plantar nerve. Now, ultimately, all pain on the bottom of your foot has something to do with the medial plantar nerve, because that's what sends the signal from the tissues in your foot up to your spinal cord and up to your brain so that you're aware that there's a problem. And oftentimes, just stepping on that nerve over and over and over every time you take a step when you're walking can get that nerve irritated. So the nerve itself can become a source of the pain. But even when it's not, those foot muscles that are in the bottom of the foot can become a source of the pain as well. So how do you stop the muscles and the nerves in your foot from hurting while you walk? Well, one of the most common causes of plantar fasciitis and other types of foot arch pain is what's known as overpronation, meaning your foot flattens out too much when you're walking. And you can see when I walk here that if I go like that, that not only stretches out the plantar fascia on the bottom of the foot, but also brings the arch closer to the ground where it steps on the muscles in the foot, particularly the abductor hallucis, meaning the muscle that spreads your toe out this way, and the flexor hallucis brevis, meaning the muscle that flexes the toe this way. It also steps on the medial plantar nerve, which runs right along the inner side of the arch. So an easy way to stop foot pain when you walk is to not allow that overpronation to happen. Now, one way you can do that is by kind of gripping the ground with your toes to actively lift your arch up. That uses a muscle that runs on the inside of your ankle, your toe flexors, and those deep muscles inside the foot. So when you activate those 4 layers of muscles inside the foot, they help you to lift your arch and keep it from flattening down on all the structures, causing the foot arch pain when you walk. But when you go to take a step, if your calves are too stiff, eventually you're going to have to flatten the foot down to be able to take a longer step. So stretching your calves is another really important thing if you have plantar fasciitis or other types of foot arch pain. Now, most people, when they stretch their calves, they'll allow their foot to kind of point out to the side slightly, and their foot will actually flatten down. So when they're stretching their calves, they're actually doing the motion that causes the pain in the first place, which is overpronation. And so to make sure you stretch your calves correctly and don't further play into that problem, you want to dome the arch while you're stretching. Keep the toes pointed straight ahead and the heel straight on the floor, and then only stretch in as far as you can without allowing the arch to flatten or without allowing the toes to turn out. Now you'll notice you can stretch a lot farther this way than you can like this, but that's okay. A lot of times that stretch or that burn that you feel when you're stretching is actually just overstretching nerves anyway. And again, that nerve problem can play into your foot pain. So make sure to keep your arch domed when you stretch, and also keep it domed when you walk. Now remember, there are also the joints in your foot. And your foot is not just one solid structure. It's made of several little bones in your ankle, and then your metatarsals, and then ultimately your toes. And somewhere in that midfoot, either a bone called the navicular or the cuneiforms, which are right past the navicular, when you overpronate your foot, sometimes those bones will squirt down out of the arch and start putting pressure on the nerves, the muscles, and the plantar fascia itself. So again, regardless of which of the structures is causing the problem, if you don't overpronate and don't let that bone squirt out, then it's going to help prevent your symptoms. But what do you do if the bone has already squirted out? Well, there are some simple stretches that you can do to help get those bones in the middle of your foot moving correctly and to go back into place so that they're no longer putting pressure on the muscles, the nerves, and the plantar fascia. So here's how you do the stretch. You'll sit down in a chair like this and cross one leg over the other. Then you want to find a spot along the bottom of your arch here where it kind of sticks out a little bit. So if you picture the contour of the arch, you'll notice it kind of dips down a little bit and then comes back up. And where there's something sticking out, you want to take your thumb and put it right on that bone there. Then with your other hand, you put your thumb right next to that thumb and wrap your fingers around the top of the foot. So you have the fingers together on the top of the foot, the thumbs together on the bottom of the foot, and this thumb that's closest to your ankle is pushing on the bone that kind of sticks out. Then you take the hand that's wrapped around the top and you just twist in the arch like that. Show it from a couple different angles here. From the top side, you're twisting so fingers are together. From this angle. And again, this thumb is holding that bone in place. Now, once you've done that, kind of hold your foot in that arch and then scrunch your toes a little bit. This activates those muscles in the middle of the foot, those deep intrinsic foot muscles, and helps you actively maintain your arch. So hold for about 5 seconds, and then relax. Hold for about 5 seconds, and relax. And this isn't just bending the toes like that. That actually uses muscles up further in your leg. You're actually trying to bend the foot in half. So not just moving the toes, but doming the arch, getting the metatarsals to move. And repeat that for 10, 15, 20 repetitions. Then when you go to stand back up, you want to do that same thing, shorten the foot, get the foot arch lifted, and then only take steps long enough that you can do it without allowing the foot arch to collapse. Like that. So you want to keep that arch elevated. Now, how often should you do that? Well, ideally, anytime you walk. And that can be difficult, especially if those muscles have gotten deconditioned and you've been walking with a flat foot with bones sticking down for a long period of time. So in that case, it can be helpful to use orthotics or arch supports that help hold those bones up in place. Now, does that mean you don't need to scrunch the muscles in your foot? No, you should still probably be doing that. But the orthotic or the arch supports give you a little bit of extra support so that your muscles don't have to work quite as hard while they're not as strong. And eventually, the goal is to be able to strengthen those muscles enough that you no longer need the arch. Because just like wearing a back brace or a brace in any other area, if you don't activate your foot muscles and you become dependent on the orthotics, then you're never going to be able to get away from them. So you want to make sure you're activating the foot muscles while you're wearing the orthotics, and eventually over time you'll get to where you can activate those muscles so you can walk around the house or other places barefoot without needing the orthotics all the time. So hopefully you did find this video helpful if you are having foot arch pain. Now if you are in the St. Louis area and you need more help for plantar fasciitis or other types of pain on the bottom of your foot, we'd be happy to help you out here at More for Life. And if you're watching this from somewhere else but you found this video helpful, give it a like, and if you haven't already, subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.